Caitlin. I'm going to be your nurse today. I'm going to wash my hands, pull the curtain for privacy. Do you have any pain or allergies?
No.
No? Okay. Can I check your wristband? And can you tell me your name and your date of birth?
Taylor Parker, July 8th, 96.
And can you tell me where we are?
Detroit Mercy,
And can you tell me the year?
2016.
Good. The patient is ANL times 3. She appears her stated age with appearance. She has overall good hygiene. Her speech and affect are appropriate. She appears to be comfortable and calm with no present signs of illness. I'm going to start with your scalp. So there's no signs of lesions or presence of parasites. Her hair is evenly distributed and thick. The skin on her face is dry, warm, and intact. And can you pop your cheeks for me? And smile. Her face is symmetric. Cranial nerves 5 and 7 are present. Her nose is midline. Her eyes appear to be symmetric. And follow with a light inward. Good. Her eyes are perla. Conjunctiva is pink and moist. Her sclera is white. And then I'm going to look in your mouth and just say ah for me. Her uvula is midline and retracts when she says ah. Her tonsils are present, grade 1. Her mucosa is moist and pink. Her tongue is midline with no presence of lesions, no abnormalities in coating. Her teeth are present and white with no signs of dental caries. Her gums, there's no signs of gingivitis or edema. They are pink and moist. Her neck, I'll do the neck. Her trachea is midline. Her carotid pulses are grade 2 on both sides. I'm just going to listen to your neck, so if you could just hold your breath for me every time my stethoscope touches you. There are no bruits. And then if you could just turn your neck side to side for me. There's no signs of JVD. Now I'm going to listen to your lungs. Every time my stethoscope touches your chest, you can just take a deep breath. Good. And I'm going to listen to your heart. Aortic, right sternal border, second intercostal space. Pulmonic, left sternal border, second intercostal space. Herbs, third intercostal space. Tricuspid, fourth intercostal space. Mitral, fifth intercostal space, midclavicular line. I would also wait here for 60 seconds to listen for the apical pulse. Her heart sounds are normal with normal rhythm. And now I'm going to go back up and listen for murmurs. There's no presence of murmurs. Now I'm going to listen to your back of your lungs. And then you can just take a deep breath again for me every time my stethoscope touches you. and then cross your arms for me. Her lung sounds are clear. Can you bend forward for me? Her spine is straight with no vertebrae sticking out. And then can you just tell me if you have any tenderness when I percuss? Good, so there's no tenderness when I assess the costovertebral angle. And then her AMP diameter is 1 to 2. Now I'm going to assess your arms. The skin on her arms is intact and dry. She appears to be warm. Her skin color is normal for ethnicity. Her brachial pulses are equal and bilateral, +2 grade. Her radial pulses are equal and bilateral, +2 grade. And then can you grasp my fingers for me? Good, and then can you go like this? Her grasp strength is appropriate and there's no signs of clubbing in her arms or in her hands. There's cap refill in both fingers and it comes back within less than 3 seconds. And then now I'm going to assess your abdomen. Lay down for me. There's no lesions or scars to be noted. The umbilicus is midline. The contour of her stomach is flat. Her stomach is symmetric. Right upper quadrant, liver and gallbladder. Left upper quadrant, stomach and spleen. Left lower quadrant, sigmoid colon and ovary. Right lower quadrant, ascending colon and appendix. There's bowel sounds in all 4 quadrants. And then I'm just going to percuss. There's dullness over the liver. All remaining quadrants have tympany. And then I'm just going to palpate your stomach and then you can tell me if you have any pain or tenderness.
No pain, no tenderness.
Okay, good. And then you can sit up for me. The skin on her legs is dry and intact. It is warm. Her hair distribution is even on both sides. And then can you just scoot out just a little bit more? Yep. And you can kind of just relax your legs, yeah. Her popliteal pulses are equal and bilateral, +2 grade. Posterior tibialis pulses are equal and bilateral, +2 grade. Dorsalis pedis pulses are equal and bilateral, +2 grade. Her cap refill on both extremities is less than 3 seconds. Babinski reflex is present in the left leg. Babinski reflex is present in the right leg. And then I will have you stand with your feet together and your hands to your side. And then close your eyes and lift your left leg. Okay, the patient has appropriate balance. And then I'll have you walk from here to the cabinet. Good, and then you can walk back. The patient has steady gait, and you can sit back down. She has no edema present in her limbs, her ankles, or her feet. And this concludes my head to toe assessment.